Hi, my name is Chris Perrin and I'm a paramedic in Ames, Iowa. I'm here to talk to you today about heart attacks, how to recognize them and what to do. In our medical language, we refer to a heart attack as an acute myocardial infarction. Acute myocardial infarction means, acute means sudden, myocardial is heart muscle, and infarction means death. And what that means altogether is that at some point in some place in the heart, there's not adequate circulation, and without circulation or blood flow to that area, there's death to that tissue. That creates the condition known as acute myocardial infarction, or as the layman term is heart attack. How do we recognize that? Well, that's what's going on kind of at the cellular or the organ level. How you recognize that in yourself or a loved one, a coworker, or anybody that's near you is a cluster of what we call kind of classic signs and symptoms of a heart attack. Chest pain or pressure, that's typically in the center of the chest. Pressure as in squeezing, which also contributes to a sensation of shortness of breath. It is a pain or pressure that does not relieve itself when the person stops. If they're mowing the lawn or they're doing something and they rest, they still have that pain and pressure, then the damage is still occurring. They need to continue to rest, but we need to do emergency actions, which would be calling 911 and considering giving them an aspirin if they're not allergic to it. Now, the chest pain might not be the only symptom that they complain of, and we want to talk about what some of those other ones might be. In addition to the chest pain or pressure, it may be some radiation of that pain and pressure. That would be to the shoulders, to the arms, sometimes to the back, and rarely, but still noted in a few patients, it can even move up into the jaw or beneath the eyes. That's the classic pain presentation. But as the heart is not getting adequate circulation to some part of it, it sends signals to the body to do some other things that create some additional symptoms and signs that you might see or hear from somebody that's having a heart attack. Nausea. They tend not to have an appetite at all. In fact, they're sick to their stomach because there's signals to your GI system, which includes 26 feet of intestine, not to perfuse it, divert that blood, and instead perfuse the heart. So the nausea is a presentation that's very common with heart attack patients. In addition to that, the skin is pale, it's clammy or wet. The heart that is not functioning well sends a signal to send out some adrenaline or epinephrine to the body to help divert the blood and to strengthen the heart's contractions itself. And that adrenaline, the side effect of it that we've all experienced whenever we have a surge of adrenaline, is a paleness to your skin because the blood's been diverted, and a wetness to the skin as it's preparing to cool itself off during some exertion. So we've got the signs and symptoms that we've just discussed. What are the actions? The key actions are to call 911 right away. People that experience heart attacks often are in denial, thinking that it's something else. Oh, it's just my stomach. It's just a little bit of back pain, or oh, it'll just go away. Well, heart attacks don't go away. They, in fact, can get worse. They can grow in the area of the heart, in terms of the area of the heart that's involved, and become more damaging and more unstable to the patient. So as soon as we recognize the signs and symptoms, call 911, get them to rest, consider an aspirin for them. If they take nitroglycerin because they have a heart condition, you might assist them in taking one of those nitroglycerin tablets.